I've always lived a healthy lifestyle. I've always been pretty active. Kayla and I are pretty adventurous people. We like to do things outside. We do a lot of hiking, a lot of biking. Life was really good. We were just living, the three of us, Kale, Kennedy, and I. We were happy and healthy. Then all of a sudden, one day, things just took a really harsh turn very quickly.
She was in severe pain, not coherent. The symptoms escalated to a point that she had trouble walking. I was pretty scared and called the emergency room, and they said, come in right away.
Stephani was diagnosed with meningitis, which is an infection and inflammation of her lining of her brain and spinal cord. Further diagnosis, we found that she had endocarditis, which is infection involving the lining of the heart, which typically involves heart valves. And for her, the mitral valve was involved and infected as well. So what she thought would have been a typical flu or COVID, which they ruled out, ended up being a serious health diagnosis, and she needed urgent treatment to potentially save her life.
We had spoken to multiple professionals, and they all pointed to M Health Fairview. And I think the big thing that came from that was a confidence that we were getting the best of the best, that we had the best chance of a positive outcome, the best chance of the outcome that we wanted.
The initial treatment options for these kinds of infections are antibiotic therapy. However, once we got to see her and look at all her studies, we determined that it was pretty evident we needed her to receive a valve replacement. The two valve replacement options we have are mechanical valves versus tissue valves.
A lot of times a mechanical valve is recommended for someone who's younger because the valve lasts a lifetime. But for me, one thing that was really important to Kale and our family was to grow our family. We wanted more kids. Then it was our understanding that if we were to go with a mechanical valve, I would need to be on blood thinners for life, which could cause complications to a pregnancy. So for us, what made the most sense was to move forward with a tissue valve.
First and foremost thing is to do the operation safely and have the patient survive, but at the same time, we also want to take into account their lifestyle choices and quality of life. So that's a big part of preoperative discussion as to what we can do to really accommodate when we operate on patients that carries serious consequences that'll change their lives afterwards.
I was taking a medication to manage the heart failure, and I was also attending cardiac rehab on a regular basis. I started getting more energy. I was no longer short of breath. I started to feel better. In October, we got the official approval to take a trial period off of my medication. And then in November, the follow-up echocardiogram showed really great results. So at that point, we got the approval to stay off my medication and the okay to continue to grow our family. And then in early December, we found out that we were pregnant with our second child, which we were very, very thrilled about.
2 weeks ago, we were blessed with her, Madison. Birth of our daughter has been just as good as we could ask for.
We're looking forward to getting out there again, doing some hiking, maybe in Colorado, and then also continuing to grow our family. I'm extremely grateful to the team at M Health Fairview for the care that they gave and the support they offered. Life is so good.